5-Minute Pearls for Clinical Practice. Today's pearl is called 3 Steps to Help Our Patients Take Their Medications More Consistently. Hello, this is Dr. Brian Morris, and this is 5-Minute Pearls for Clinical Practice, where you will learn the tools to provide exceptional care for your patients. This is the weekly podcast where you will be introduced to time-tested, evidence-based patient care strategies that aren't always taught in schools or training programs, but are nonetheless crucial for success in clinical practice. One of the biggest challenges that clinicians face is patients not taking their medications as directed. In a study published in the New England Journal of Medicine, about 50% of patients admitted that they don't take their medications as directed. 50%. Other studies have found that this number is actually closer to 75%. This is a big problem in healthcare, as some medications can cause problems when not taken as directed, and they certainly won't provide the full benefits to your patients when they are not taken as directed. How can this be? How can it be that patients spend their time and their energy to visit a healthcare practitioner and get his or her advice and recommendations, and then decide not to follow the advice? If you read through these studies carefully, you will see that most of the time when patients don't take their medications as directed, it is not because they disagree with the choice of medication, or even that they disagree with the general recommendation to take anything. Most of the time when patients don't take a prescribed medication, it is because they simply forgot. The bottle is sitting in the patient's bathroom cabinet, or it is sitting by the coffee maker in the kitchen, and the patient simply forgot to take it on that morning. The Lipitor bottle may be there in the bathroom. However, the patient can't seem to remember to take that pill every day. When patients are asked about this, they often say that they mean to take their pills on schedule, but in reality, they simply don't remember to make that happen most of the time. Let me give you 3 ideas that I find very helpful to make sure that my patients do take their medications as we agree to during an office visit and as prescribed. Will these steps work 100% of the time? No. But will they help your patients be more consistent with taking their medications? Absolutely yes. So here are these ideas. Number 1, when you prescribe a new medication, make sure that the decision is a mutual one and that the patient fully understands the benefits as well as the risks of taking the medication. Working with patients is a partnership. It is not a dictatorship. As clinicians, our role is to partner with our patients to help them to be as healthy as possible. And that means that we are consultants to them. We are partners in their health. We are not their parent. We are not their supervisor. If patients see us as their parent, dictating to them what they should do or should not do, there's a much greater chance that they won't be as engaged as possible to follow our recommendations. So when we prescribe a medication, we need to make sure that the key risks and benefits of each medication are fully discussed with the patient, and that you and the patient mutually agree that taking this medication is the right thing to do. So if you are prescribing penicillin for strep throat as one example, it is very important to make clear to the patients exactly why penicillin should help resolve the infection and lower the risk of strep-related complications elsewhere in the body. You should discuss with the patient the importance of taking the full course of the treatment and what could happen if the pills are not fully taken. Likewise, if we prescribe a statin for someone who has just had a heart attack, we should discuss the risks and the benefits of the statin with the patient so that they fully understand that the statin typically lowers the risk of having another life-threatening heart attack. It's amazing how regularly a patient can take a medication once they really understand the potential benefits that the medication offers. I find that clinicians are often very thorough when explaining the risks associated with a certain medication, but sometimes don't have enough time to review all of the potential benefits that that medication can offer. If you don't have the time to fully explain the risks and benefits to the patient, then feel free to create handouts to give to patients that list the risks and benefits of each medication and why you feel it's the right decision. But even if you do that, please remember that the conversation about a medication needs to be a two-way conversation and not just our touting the benefits of the medication that we're prescribing. The conversation needs to be a give and take where we address all of the patient's questions and concerns and make sure that this is a mutual decision. Going back to podcast episode number 2, we need to trust our instincts and sense if our patient isn't quite comfortable with the medication, because if this patient is not quite comfortable with the medication, there's a high likelihood that he or she won't take the medication as directed. If you have not yet heard podcast episode number 2, please go back and take a listen to that. Sometimes a patient is uncomfortable with a specific medication. For example, plenty of times a patient is not comfortable with a medication and the discussion needs to be fully explored to see if this truly can be a mutually agreeable decision. Recently, I had a patient whose friend had side effects with a certain statin medication, so he wasn't comfortable taking that specific statin, but he was comfortable taking one of the other statins. By fully exploring his concerns in just a couple of minutes, we were able to find a medication which he was comfortable with and also which I felt met his medical needs. Again, this is a partnership rooted in effective communication. Idea number 2 is the pill box. Many of us remember going to visit our grandparents and seeing that old trusty pill box in the bathroom. Pill boxes have been popular for many years, and there's a reason why. Pill boxes help patients stay organized with their medications and be consistent. They are certainly very important for patients who take a lot of medications every day, but it's also important for those who simply take 1 or 2 pills a day. Why? Because even one pill can be challenging for us to remember given how busy our schedules can be. Sometimes we are rushed in the morning and it's very easy to forget something like a prescription medication, so having that pill box can serve as a reminder for us. Also, almost every patient has gone through that moment when he or she can't recall if they've taken the pill earlier in the day. By having a pill box, the patient can look in the box for that day and see if the pill has already been taken. Patients are much more consistent with their medications and are much less likely to double dose on a medication. And lastly, a third strategy to help patients improve compliance with medications is to prescribe once daily medications rather than twice or 3 times daily medications whenever possible. Multiple studies have shown that patients are much more consistent with taking their medications when they are prescribed once daily rather than twice or 3 times daily. Of course, this is not always possible, but if it is, try to find a once daily option. So these are some strategies to help our patients be more consistent with taking their medications. Number 1, have an informed give and take conversation with patients before prescribing the medication to make sure that you and the patient are fully agreed on the plan. To make sure that you and your patient fully agree on the plan. Number 2, recommend that your patients use pill boxes. Number 3, try to prescribe once daily medications whenever possible. By following these strategies, your patients will hopefully be more consistent with their medication regimens and have better healthcare outcomes. Let's keep the dialogue going. Let me know what you think of this week's Pearl for Clinical Practice. You can email me at drmorris@5minutemd.com. That's DRMORRIS at 5minutemd.com. You can post your comments and your experiences on the 5 Minute MD Facebook page. You can follow us on Twitter at Brian Morris MD. And you can visit us anytime on our website, 5minutemd.com. Let your friends and your colleagues know about the podcast and make sure that you are subscribed on iTunes. When you are subscribed on iTunes, you will receive new podcast pearls as soon as they are posted. And if you have a few minutes and you enjoy what we're doing here on this podcast, please head over to iTunes and leave us a review. Thank you so much for listening. I will see you at the next 5.